Peroxide systems frequently provide patients with a comfortable wearing experience because they allow for appropriate cleaning and disinfection of the lens through 3% hydrogen peroxide in contact with the lens for a critical time period. This is easily accomplished in branded products because the cage that actually holds the lenses is connected to the neutralizing platinum disc, so they are simultaneously submerged into the hydrogen peroxide. It provides a safe and logical one-step system to care for the contact lenses if hydrogen peroxide is an appropriate care system for that patient. Now, there are 3 things that we feel are critical to remember when considering peroxide systems. First, reverting the lid on every contact lens wearer to identify the presence of a papillary response on the upper tarsal plate. Although it's simple to identify a GPC when averting the lid, if it's not averted, it will oftentimes be overlooked. If these contact lens wearers are not candidates for daily disposable lenses, a hydrogen peroxide system is well suited for these patients when it's appropriate to start wearing lenses again. After appropriate treatment for the condition that's occurred, or the GPC, it will oftentimes allow the tarsal plate to remain quiet in the presence of lens wear. Second, don't forget about its valuable use for gas-permeable lens wearers. Although we sometimes forget about this as a viable option for these patients, keep this in mind for those with ocular allergies, depositing issues on the lenses, or those with general discomfort of their gas-permeable lenses. Third, be sure to keep this in mind as an option for patients who have suspected sensitivities to the multi-purpose disinfection solutions they're using. Although we advocate utilizing fluorescein dye on every patient at every encounter, it's critical to utilize the stain to optimize the view of the ocular surface. Additionally, unexplained conjunctival hyperemia in a contact lens wearer can also lead to clinical suspicions of some type of multi-purpose disinfecting solution sensitivity. Hydrogen peroxide systems have a number of advantages. Be sure to keep several things in mind to make sure appropriate recommendations for peroxide systems are made when clinically appropriate. Make sure to avert the upper eyelids of contact lens wearers and determine the presence of GPC or giant papillary conjunctivitis and the potential need for hydrogen peroxide in some of these individuals. Consider hydrogen peroxide for gas-permeable lens wearers, and make sure to consider hydrogen peroxide for those you suspect have a multi-purpose solution sensitivity. Keeping these things in mind will help us appropriately care for our patients, which is ultimately why we do what we do.